Hi everyone, this is Tori Vandelin with Prevent Connect. This is part one of a 4-part podcast with the authors of the study, Expanding the Frame, Institutional Responses to Students Accused of Sexual Misconduct. On this podcast, Jennifer Hinkle, Joan Tabachnik, and Jill Dunlap discuss the current state of respondent services on campus and describe what respondent services are. Thank you all so much for joining us today on this Prevent Connect podcast. We are super excited to talk about the study you all were a part of and how it relates to primary prevention of sexual violence. So, before we get going, I want to give you all an opportunity to introduce yourselves and your roles.
But my name is Jennifer Hinkle. During this research, I was working at the University of Kentucky, but doing this work through the College of Education and through what is now my starting my PhD program. However, now I work with NASPA in the Culture of Respect as the program manager for that initiative, which is our initiative for ending campus-based sexual violence.
My name is Jill Dunlap, and I am the Director for Research and Practice at NASPA. I've been at NASPA a little over 4 years. And prior to coming to NASPA, I worked at 3 different institutions, primarily in the areas of gender equity and sexual violence prevention and response.
And my name is Joan Tabachnik, and I've been working in the field of sexual violence prevention for about 25 years, and right now have a consulting practice, DSM Consulting. And the particular focus I've always had over the course of my career is been focusing on preventing the perpetration of sexual violence. So I particularly was excited when I learned that Jennifer and Jill were collaborating on this and felt really privileged to be able to join them on this exciting project.
Thank you, Jennifer, Jill, and Joan. And so we're here to talk today about the study, Expanding the Frame, Institutional Responses to Students Accused of Sexual Misconduct. Can you all tell us a little bit more about the study?
Sure. So this is Jill, and we I really think the genesis of this project happened at a sort of day-long drive-in conference that NASPA was hosting, where I met Jennifer and we made a connection, and we kept in touch, and we're really starting to hear from a lot of colleagues about some of our people in the field in student affairs, especially, who were being advised by their general counsel and among other higher leadership, who may not really understand sexual violence in the sort of day in, day out way that many of our student affairs prevention or student affairs professionals do, that they were being asked to provide services for survivors and services for respondents that were equal. And so in that way, they meant that their campuses wanted to do one-to-one services for, if they provided it to survivors, they needed to provide it to respondents. And so there was some, I think, frustration among student affairs professionals who, again, do this work every single day, that there was a lack of understanding about what the specialized needs of each population might be. And so, and we, to that point also, we knew that many institutions were already sort of undertaking the establishment and implementation of separate respondent services from survivor advocacy, and that they were doing really great job. They had fully developed job descriptions. They knew where it should be housed, and so that there was, enough separation to ensure for the safety and privacy and confidentiality of both parties throughout the process. And so we thought, let's see what's out there. We knew that it was happening anecdotally. We knew that we were being approached by colleagues who had some frustrations. And so we said, let's see let's do a landscape analysis and see what we can find about how this is happening across the country. And so Jennifer and I started in that way. And in an effort to be really inclusive, we reached out to a lot of different folks in the field who do this work from a variety of perspectives, and met Joan. And, she said, I'd love to see, the survey instrument that you're developing. And she provided some great feedback. And then, came on board as a full research partner and co-author on the project. So it was really very organic, I think, but really driven, I would say, by the the sort of concerns we were hearing from our colleagues in the field that do this work. And I welcome Jennifer and Joan to weigh in as well if they have different recollections of how the project started. But
No, that's exactly right. And from my perspective, having been in higher education case management for a number of years, and at the time I was serving on the leadership team for the Higher Education Case Managers Association, or HECMA, and we had been seeing this as a new position, if you will, new positions being listed on our listserv specifically for respondent services, seeing more people proposing conference sessions on this. But also at the time, Jill and I were starting out, we were trying to count how many institutions that we could think of that were doing this. And honestly, we barely got into our second hand when counting our fingers, how many institutions we just knew of straight away. So we really wanted to see, okay, is this happening? And if it is, what on earth does it look like? Because obviously people aren't talking about it in a large group.
It's super interesting that this study was born from the concerns of the colleagues in your field that you had noticed in student affairs. And I think what is really unique about it, too, is that focus on what the specialized needs are for all the different parties that can be involved in this process. So I wonder if you all can describe a little bit more in depth, what do respondent services typically look like on a campus?
Yeah, and I mean, this is Jonah, this is exactly the question that we wanted to explore as we were getting lots of information anecdotally. And what I think, some of the things that we were, surprised about, or, that given that we had so much anecdotally, when we asked people, the survey participants, what kind of services, did they have? 99% said that they were offering some type of services to responding parties. And so then we, through the questions, we delved in a little bit deeper, and it's like, what are those services? What do they look like? And this is where it became a little bit, varied from school to school, but pretty much, over 60% said that that part of the service they provide is just explaining to the responding party their rights and assist them in their the investigation and hearing process. And also, they refer to available both on campus as well as off campus resources. They help them access interim measures. So this might be things like class changes or no contact directives, also academic accommodations if they're needed, and also understanding what the protective orders that they may be given, what that looks like, and how to make sure they adhere to it, and then accompanying the responding party to conduct meetings or hearings. So most, over 60% offered one or more of those kinds of services, as well as reentry after suspension was 59%. Also, access to legal services. What we found was that where there was seemed like a real gap was that fewer schools, only 13% offered any kind of support for a student who might be transferring in with a notation on their transcript that they have violated a sexual misconduct policy on another institution. And only 10% said they offered any kind of safety planning or support for people who might be in the sex offender registry. So there's a whole variety of services that are being provided. And most of those services, when people talk about them, are about, once a complaint has been made, so helping them through that process all the way through the sanctioning. So that seems to be the majority of what those services look like on campus today. The other piece maybe that we found that was that most of the participants, like almost 3/4, said that their campus had been providing services specifically to responding parties, as opposed to maybe general conduct process advisors. So it's not like they weren't doing it before, but that they were specifically looking at respondent service for fewer than 5 years. So it's fairly, I think, as over the past 5 years, has been a real shift. And I think what Jennifer and Jill both referring to, that's not only a shift, but there's actually been much more attention and a growing amount of support and resources for these students.
So it sounds like there is a wide variety of services that campuses, colleges, and universities can offer respondents for support. as well as some pretty significant gaps, as you had mentioned too. So, what were the recommendations that you all had included in this report for how campuses can improve respondent services or offer, even in the first place, respondent services?
Yeah, so this is Jennifer. And what we did in the report was break it down into kind of responsibility or focus. So, looking at the institutional level of what can be done and what recommendations we had, and the community and policy level. Looking at the institutions, we see that there's not consistent positionality of respondent services. And when we say positionality, we've still kind of played with whether or not to use that word in particular, but what we mean is where are they located on campus? Because at some institutions, they are reporting to the dean of students and they're within higher ed case management. At other institutions, they're under the Title IX office, and within Title IX, it varied, and we saw a really um, low level majority for kind of the top three, being case management, Title IX, and Dean of Students. So having a consistency in that will allow for respondent services to kind of be more consistent overall in the landscape, and allow institutions and professionals who are doing this work to really come together and make things look a little bit more similar as a field, as opposed to a bunch of campuses offering something that's really great but just not really knowing what to offer. We also looked at or said that institutions should try to consider ways to expand the range of students who are being served. We wrote in the report respondents or responding parties, but what we really mean by that is also looking at those with problematic sexual behaviors who may or may not have been reported to the institution. Um, so, students, when we were speaking to other institutions, actually some in Canada, they were talking about how they've had students come to them saying, I think something happened at a party and it didn't quite feel right. My friends called me out on it. I think I may not have asked for consent, or whatever the situation was, and really wanted services to be able to explore that and find additional support so that they could learn from that situation. The way things are now, a lot of campuses either don't have that or don't have things set up in a way to really allow for students who may be in that situation to come forward and ask for help. I also found that most campuses weren't actively informing the campus community about services. So instead of just including it in the Title IX policy, that blanket policy that's written in legalese and can be really hard for students to read. Some campuses were sending a letter directly to students who were identified in those cases. Others were providing some sort of training during first year student orientation and transfer student orientation, but those campuses were not very well represented, and the vast majority weren't actively doing something, in that there wasn't social media or kind of getting out there in front of students face to face to talk about this. Also, increasing their knowledge of community resources. So, for our schools who are in areas that were at institutions that may not have as many resources that are available to either party, really looking at what's available in the community, whether that's therapy, whether that's legal services. The vast majority of our campuses just weren't exploring that or didn't know that it was necessarily available. And Joan has been great through this process of doing this project, because that was something that I don't know that I knew was even available. And she's been talking a lot about these amazing organizations that exist out there that you can honestly just go to and type in your zip code and be able to find some amazing resources. But obviously, campuses don't know that this is something that they have access to.
Hmm.
Then, moving a little more broadly, so looking at community and policy, we know that campuses really need a clear definition of what is equitable and what is equal, as well as what is then expected. So we know equal is that 1-to-1, and equitable means, not just everybody has shoes, but everybody has shoes that fit. So what does that mean when it comes to, specifically in the United States, Title IX and campus requirements when it comes to providing services and what is expected? A lot of the campuses we had talked to in those beginning stages were coming and saying, our legal counsel says it has to be equal, even though that's not what's said, because there are very few words in the law. There's actually Title IX. But not only getting a clear understanding of what is it that is expected, but also what that specifically means for your campus. Because we also know that responding parties don't need the same thing as reporting parties. A reporting party may need access to healthcare, especially in 24 hours if we're talking about a crisis situation, whereas that's not necessarily something that responding parties need. So how do we meet students where they are if we don't know, again, what is expected? Also, specialized training for those providing respondent services, recognizing that there have been amazing trainings that have been going on over the last few years, like I mentioned with HECMA, and the number of institutions that were coming to our annual conference and presenting on what their campuses were doing when it came to respondent services, as well as different NASPA conferences that were having similar trainings. I know Joan and a lot of her colleagues have been doing similar presentations on not only how respondent services may look at a specific institution, but looking at really fantastic information from the SMART office and what's currently available and what types of things individuals with problematic sexual behaviors may benefit from. But nobody was doing it in the same way that we see is available for Title IX coordinators, like through organizations like ATIXA, and things that are available for campus advocates and those available for the reporting party. We have 40-hour trainings that exist for campus advocacy or for survivor advocacy in general, but there wasn't that niche training for providing respondent services. And then establishment of best practices. So we have these recommendations, and that's great. And we have all this data, and that's fantastic. But we don't know what works. We know what the majority of institutions are doing, and we know in our minds, based on our experiences, the three of us, and our knowledge of the field, what we think anecdotally would be really great for institutions to be providing. We don't see enough assessment. We don't have enough research in this area to really know what would most benefit students when it comes to retention and when it comes to GPA and actual student feelings of support. What out of this large list of available resources and ways of doing things are most effective? So hopefully in the next couple of years, we'll see more of that.
Thanks for listening. Tune in to part 2 to dive deeper into the connections between respondent services and preventing sexual violence on campus.